Hi everyone, welcome to Adenoid YouTube channel. In this video, we are going to see about adenoid cystic carcinoma. It is the fifth most common malignant tumor of the salivary gland. It is the fifth most malignant tumor of the salivary gland. The other names of this adenoid cystic carcinoma is cylindroma, pseudo-basal cell carcinoma. It is a salivary gland tumor which is a malignant tumor and it is fifth most common. The other names of this adenoid cystic carcinoma, in exam point of view, it can be asked in the cylindroma as well as pseudo-basal cell carcinoma. So we should write this adenoid cystic carcinoma points. The other names are cylindroma, pseudo-basal cell carcinoma. The characteristic features are perineural invasion, spreads through neural spaces. The characteristics pattern are the characteristic pattern. How it looks like is this Swiss cheese or honeycomb pattern. Etiology. The proliferation of the distal and myoepithelial cells. Due to the proliferation of the distal and the myoepithelial cells, this adenoid cystic carcinoma is caused. This is the cause of the adenoid cystic carcinoma. Now we will see about the clinical features of this adenoid cystic carcinoma. The age is mostly it occurs in the age of 40 to 60 years. The gender mostly in females. Site is parotid, submandibular gland, palate and tongue. Signs and symptoms are locally pain, locally invasive. There is locally pain. Local pain is there and it is invasive, locally invasive. Fixation to the deep structure. It enters into the deep structure and there is perineural invasion, most common in nerve. The histopathology is the ductal and the myoepithelial cell proliferates in form of three patterns. This ductal as well as the myoepithelial cells. The cause of the adenoid cystic carcinoma is due to the proliferation of the ductal as well as myoepithelial cells. This ductal and the myoepithelial cell proliferates into three patterns. The first pattern is cribriform pattern, and the second one is tubular pattern, and the third one is solid pattern. Now we will see about the solid pattern. The solid nest of basaloid cells without any cystic space. That is, it forms a nest-like structure of the basaloid cells, which forms a nest-like structure without any cystic spaces. And the cribriform pattern. The cells of the basaloid are with cuboidal. The cells are basaloid cuboidal with hyperchromatic nuclei and are arranged to form cystic spaces filled with coagulum. There are cystic spaces present and the nuclei is hyperchromatic filled with coagulum, and this pattern known as Swiss cheese or honeycomb pattern, and this is the most common type. The tubular pattern. The structures are lined by the layers of the cuboidal cells. The structures of this are lined by the cuboidal cell. The treatment is surgical excision and combined with chemotherapy. The surgical excision of this adenoid cystic carcinoma with the combination of chemotherapy. Radiation therapy is contraindicated because it makes this adenoid cystic carcinoma more aggressive. So that this radiation therapy should not be given to this adenoid cystic carcinoma patients. Thank you. If you like this video, please do like, share and subscribe my YouTube channel. If you have any doubt on it, please do comment it. If you want any other topic, please do suggest in the comment box. Thank you. Please do subscribe.